Welcome to The Explainer. Today, we're diving into a fascinating and honestly incredibly urgent source that breaks down the 2026 UK dental landscape. But more importantly, it maps out a literal escape route. If you're one of the millions of people out there feeling totally trapped by endless NHS waitlists, and you're just desperately searching for a way out of those staggering private care costs, well, you are definitely in the right place. So let's get right into it.
Okay, let's kick things off by addressing the burning question for so many Britons right now. Are you waiting for an NHS miracle? Because as our source points out, 2026 was supposed to be the magic year, the year the post-pandemic backlogs finally cleared up. But instead, patients are staring at a crumbling system where free care is basically a ghost, and private fees have hit absolute record highs. And the cost of waiting is huge, not just financially, but we're talking about irreversible bone loss, shifting teeth, and a massive hit to your self-esteem. So, here is our roadmap out of this dental wasteland. First, the 2026 dental crisis. Second, the NHS reality check. Third, unmasking free clinical trials. Fourth, the dental tourism alternative. And finally, the 7-day blueprint.
Let's start with Section 1, the 2026 dental crisis, a perfect storm of inflation and backlogs.
£20,000. Yeah, take a second to let that sink in. That staggering number represents the potential cost of a full-mouth, all-on-4 restoration in major cities like London, Birmingham, or Manchester today. Our source explains that massive inflation has driven up the cost of materials like medical-grade titanium and zirconia. Couple that with a severe shortage of specialized implantologists, and private surgical fees have just gone through the roof. If you need serious restorative work, this is the massive financial wall you're expected to climb. It totally explains why so many folks are scrambling to find another way.
Moving right along to Section 2, the NHS reality check. Who actually gets free implants?
A lot of people falsely believe the NHS will eventually step in to cover these massive private costs. But take a look at these criteria. To get free dental implants through the NHS, your tooth loss has to meet an unbelievably strict medical necessity threshold. We're talking major reconstructive surgery after oral cancer, congenital things like cleft lip, horrific facial trauma, or super rare genetic conditions. It really reveals how incredibly exclusionary the NHS criteria actually are right now just to manage their dwindling budgets.
So, the harsh reality? If you lost teeth to everyday decay, long-term gum disease, or, just age-related wear and tear, you are almost 100% guaranteed to be rejected for NHS implants. The system's logic is pretty cold. If a basic, functional alternative exists, taxpayers aren't going to fund a premium surgical solution, so their default fix is a removable denture. And look, while dentures offer a basic fix, they do absolutely nothing to prevent the jawbone from melting away, which inevitably happens after tooth loss. So you're left stuck in this dental no man's land. You're not sick enough for the NHS, but maybe you're not wealthy enough for private UK care.
All right, Section 3, unmasking free clinical trials. Are they really a free lunch? With NHS doors firmly closed to the average patient, a lot of desperate folks turn to free clinical trials. Now, the word free is a super powerful marketing tool, right? But our source really emphasizes that these trials are definitely not a free smile giveaway. It's a highly clinical trade-off. These studies are sponsored by manufacturers to collect data. When you sign up, you're trading your time and your medical data, and you're taking on serious physiological risk. You might be testing an experimental 3D printed implant or brand new screw thread. You are literally patient zero for experimental hardware. And if it fails, the trial might not even cover the complex rescue surgery you'd need to fix the damage. 36 months, 3 whole years. That is the jaw-dropping average wait time just to get into one of these trials or a dental school placement in the UK right now. And as the source stresses, waiting 3 years for a tooth isn't just an annoyance, it is a massive health risk. Your surrounding teeth migrate into the gap, throwing off your bite, and your jawbone literally begins to atrophy. Honestly, by the time they finally call your name off that wait list, you might not even have enough bone left to support an implant without paying for an expensive bone graft anyway. And hey, even if you can manage to wait 3 years, getting accepted is a whole other mountain to climb. UK dental schools are completely flooded with applications, so they use what the source brilliantly calls a Goldilocks requirement. They aren't looking for the patient who needs it most. They want the perfect teaching case. If your mouth is too simple, the students won't learn anything. If it's too complex, like you need a sinus lift, it's way too risky for a student. Throw in an everyday health thing like smoking or diabetes, disqualified. They have to protect their success statistics. The end result is that 90% of hopeful applicants are ultimately rejected after months of waiting just to get an assessment.
So people try to escape this by buying premium dental insurance. But when you weigh the harsh restrictions of UK insurance against the hidden costs of a clinical trial, reality really sets in. Insurance plans often trap you with 12 to 24-month waiting periods, incredibly low annual caps of maybe £500 to £1,000, and they almost always exclude pre-existing conditions. On the flip side, trials require you to travel to major hubs like London, attend frequent super long appointments, and take unpaid time off work. That alone can easily cost you up to £1,500 out of pocket. So it becomes crystal clear. Neither of these paths is a completely free or easy way out.
Let's move on to Section 4, the dental tourism alternative, the shift to premium European implants.
Before we explore this alternative, though, a quick but absolutely crucial warning from the text: beware of predatory scam websites. You've probably seen those flashy ads promising fully funded government dental schemes. The reality, the UK government absolutely does not provide grants for private dental implants. Those sites are just lead generation traps. They want to harvest your sensitive medical data and sell it to high-cost private clinics. Legitimate trials will never ask you for an upfront registration fee, and real medical options don't use shady, everyone qualifies marketing.
Now, for the real alternative. For folks totally exhausted by the UK system, a highly sophisticated industry has matured abroad. Check out these numbers comparing UK private costs directly with the Estesi Dental Clinic in Istanbul. The math is pretty wild. A single implant and crown in the UK averages around £3,000. At Estesi, it's roughly £600 to £800. That's a 75% savings. And that terrifying full arch we talked about earlier, it drops from maybe £16,000 down to around $5,000. The source makes a really vital point here too. This is not about lowering quality. They use 3D, AI-driven digital design and top-tier European brands like Straumann. You're not cutting corners, you're just cutting out the massive overhead costs of UK clinics.
Which brings us to our final stop, Section 5, the 7-day blueprint. From a free consultation to a permanent smile.
How do you actually go from feeling completely trapped to getting a permanent solution? The source outlines this incredibly streamlined 7-day medical tourism blueprint to bypass those 3-year UK waitlists entirely. Day 1, you fly in and get a VIP transfer straight to a 5-star hotel. Day 2 is all about clinical precision, high-def 3D scans, and the actual surgery. Sometimes you even leave that same day with a temporary fixed bridge. Days 3 to 5? That's your dental holiday in Istanbul while lab techs handcraft your permanent crowns using advanced CAD CAM tech. Day 6 is your final fitting, ensuring the bite and aesthetics are absolutely perfect. And day 7, you fly home. It's designed to replace the utter desperation of a waiting list with a totally predictable, guaranteed result.
But wait, because there's usually a hurdle before you even pack your bags, right? Just getting a basic private implant consultation and a 3D scan in London can easily set you back £300. To bypass this entirely, the source points out that clinics like Estesi host free, in-person consultation days right in major UK cities. Or, and this is super convenient, you can skip the line altogether by just sending photos or recent x-rays over WhatsApp. You get a preliminary plan back within 24 hours. They are literally removing the financial gatekeeping that the UK system currently uses to keep you out.
So we're going to leave you to ponder this final question from today's explainer. Is your smile, your confidence, and your actual bone health really worth a 3-year wait on a list that might ultimately just reject you anyway? We've unpacked the harsh reality of the 2026 dental landscape today, and it really challenges us to weigh the very real physical cost of waiting against these modern, streamlined alternatives available abroad. Ultimately, it's about choosing certainty over hope. Thank you so much for joining us as we mapped out this escape route, and we will see you on the next explainer.